Hello friends, today's session is about MRCOG, and this is going to be an handholding session for the beginners who wants to pursue their career with the Royal College of Obstetricians and Gynecologists, that is RCOG. So before we learn about MRCOG, few words about Royal College of Obstetricians and Gynecologists, that is RCOG. When it started, it was named as a British College of Obstetricians and Gynecologists. It is founded in September 1929. The first president was Professor Blair Bell and Honorary Secretary Professor Fletcher Shaw. The current president is Dr. Rani Thakkar. What you see in the picture is the college building. It is situated in the London, United Kingdom. So let's learn about MRCOG. This qualification has been designed to test the skills, knowledge and clinical behavior of the doctors specializing in obstetrics and gynecology. I'll request the candidates to read this particular sentence once again. This qualification has been designed to test the skills, knowledge and clinical behavior of the doctors, and we should pay attention to this because most of our examination will assess mainly the knowledge component and to some extent the skill component. However, for MRCOG, it is the clinical behavior of the doctors that also matters a lot. This MRCOG qualification has got three parts, that is part 1, part 2 and part 3. Successful completion of all three stages is required for the membership of the college, that is MRCOG, to be awarded. Few people after clearing the part 1 write MRCOG 1 in the bracket or 2 in the bracket once they clear part 2. However, RCOG does not award any part membership. It is always a full membership once you clear all three parts of MRCOG. So what we are going to learn in today's session: 1. Why to do MRCOG, how to register for examination, what is the structure of the examination, details of part 1, part 2 and part 3, what is the timeline for various parts, that is the exam currency, what is the fees for the examination, and few frequently asked questions. So why to do MRCOG? If you are pursuing career in obstetrics and gynecology, say appearing for MS or DGO, DNB, definitely it is going to be an additional qualification with the same training done in your own country. Yes, RCOG recognizes the training which you are doing in your own country. The total duration of training required is 4 years, and you should have cleared part 1 and part 2. You should have assessed your training from the Royal College, and same hometown or home country training is recognized by the RCOG. It is internationally recognized qualification, so it's a gold standard qualification in obstetrics and gynecology. It will open up various international job opportunities for you. It will help or ease for the migration, like you are eligible to get tier 2 type of visa or settlement visa in the United Kingdom or various parts of the world. Even if you don't want to go anywhere, even if you want to practice in your own country, your practice will always be evidence-based practice once you complete your MRCOG. Not only that, nowadays many corporate hospitals appoint the doctors with MRCOG, so you are eligible to get good attachments or the attachments to the good corporate hospitals. And this slide shows the roadmap for the MRCOG. Once you have completed MBBS and your career in obstetrics and gynecology starts, you may be pursuing DGO, MS, DNB. Few candidates who are pursuing MS, after completing the MS, apply to the DNB for the examination. They just clear the DNB examination, and once they clear, they get additional degree DNB. Same way, if you complete your 4 years of training and apply to the RCOG, you will be getting MRCOG provided you have cleared your part 1 and part 2. So how to register with an RCOG? First thing what you need to do is you have to create your account with the RCOG website. Then you have to send eligibility application form to the RCOG for part 1. You have to submit expression of interest for the examination, and all these three steps, that is creation of the account on the RCOG website, assessment of the eligibility and expression of the interest, these are free of cost. It does not require any fees. The fees is required when you want to book the examination or when you want to appear for the examination. I have given all the details of these in the this particular video link. The same link will be given in the description. You can watch later this video. Coming to the structure of the examination, as I have already mentioned, this examination has got three parts: part 1, part 2 and part 3. The MRCOG part 1 will cover the basic and applied sciences relevant to the clinical practice of obstetrics and gynecology. That means the basic and applied sciences such as anatomy, physiology, biochemistry, which is pertaining to the obstetrics and gynecology, or pathology, pharmacology, microbiology, which is related to the obstetrics and gynecology, will be covered in part 1, and it is going to be a computer based examination. Well, part 2 exam assesses the application of your knowledge in clinical scenarios, and computer based testing is there in part 2 also. So part 1 and part 2 are computer based testing, while part 3 is a clinical assessment of knowledge, skills and attitudes and competencies. It's a 14 station objective structured clinical examination. Passing the part 3 exam leads to the award of membership of the college, that is MRCOG. What is the timeline for the exam or the exam currency? Actually, I would like to skip these particular slides because our aim should be to pass part 1, part 2 and part 3 in the first attempt itself. I'll just read out these slides. Part 1, you have total 6 attempts to clear part 1 and it is valid for 7 years. For part 2, again you have 6 years, but part 2 should be attempted within 7 years of part 1 if you are a full-time trainee, or within 10 years of part 1 if you are a part-time trainee. And this is mainly for the doctors who are in the UK or who are trainees from the UK. However, for part 3, whether you are UK trainee or whether you are non-UK trainee, maximum number of attempts allowed are 4. So if you cannot clear part 3 in 4 attempts, you have to appear for part 2 again before re-attempting the part 3. Okay. And if you are a overseas doctor, do not wish to enter onto the specialist register, there is no attempt limit. Candidates who do not pass part 3 MRCOG within 4 attempts will be required to retake and pass MRCOG part 2 again before attempting the part 3. So candidates who not wishing to enter onto the UK specialist register, candidates who have passed part 1 need to attempt part 2 within 10 years of their examination date, while candidates who have passed part 2 MRCOG need to attempt part 3 within 7 years of their exam date, and there is no restriction on the length of time between the attempts of the part 2 or 3 MRCOG. Now let's learn something about MRCOG part 1. As I have already mentioned, it is a computer based examination. It will have 2 papers, each paper with 100 single based answer, that is SBS. Both papers contribute equal to the final score. Paper 1 SBA, there are 100 SBS, duration is 2.5 hours, that is 150 minutes. Paper 2, again 100 SBS, duration 2.5 hours. There is a lunch break approximately 1 hour after the paper 1. So total duration is 5 hours plus 1 hour of lunch break, that is 6 hours. So one should be mentally prepared to appear for this long examination. Now what is the covered, what is the structure of paper 1 and paper 2? There are total 12 modules. Paper 1 will cover 6 modules, paper 2 will cover 6 modules. Paper 1, their modules are anatomy and embryology, physiology, biochemistry, endocrinology, epidemiology and biostatistics and genetics, while third column shows what is the percentage of the SBA which contribute in paper 1. So maximum weightage here is given to the anatomy and embryology, 25 to 37%, and epidemiology biostatistics carries also around 12 to 15%. Physiology carries 12 to 15% of the SBS, while rest of the modules will have around 8 to 11%. So total SBS are around 100. We should know while preparing which modules carry maximum weightage. Paper 2, that is modules 7 to 12, are pharmacology, microbiology, immunology, biophysics, pathology, clinical management and data interpretation. And here you will learn that clinical management and data interpretation has got maximum weightage. Around 20 to 23 questions will be from this particular module, while other modules will contribute around 12 to 15, almost in the same manner, and the total SBS are 100. This is an example of SBA. You can read this particular question. A 24-year-old presents at 27 weeks into her second pregnancy, feeling unwell, backache, fever and rigors. She has got a temperature of 39.5 degree. Urine analysis shows leukocytes and protein is 3+. Her blood pressure is 80/50. Which action is most appropriate? There are 5 options which are given. Which is the most appropriate action? The answer given is A. She requires admission to the ICU or HDU for IV antibiotics and supportive care. So this is a case of sepsis, and most appropriate action is given in option A. So similarly, there will be 100 MCQs and single based answer questions covering various modules. The same what we have seen in tabular form here is given in pie charts along with their subjects weightage. Coming to the part 2, part 2 is also computer based testing. It will have 2 papers, each contributing 50% to the final score. Single based answer questions will contribute 40% of marks in each paper, and EMQs will contribute 60% of the marks in each paper. So when the score is calculated for paper 1, there will be 50 SBAs and 50 EMQs, that is extended matching questions. But when the score is calculated, the EMQs is given 60% weightage, while SBAs is given 40% of weightage. So the structure is paper 1 total duration is 3 hours. There will be 50 SBAs and 50 EMQs. However, while calculating the score, the 60% weightage is given to the EMQ and only 40% is given to the SPAs. So EMQs are very, very important, and that is why most of the doctors find it very difficult, because EMQs will have a very long scenario, around 8 to 10 line scenario will be there. After that, there will be some investigation chart will be given or CTG will be given. You have to correlate the clinical information with the graph which is given, and then select one appropriate answer, and the options may be 15 to 20 options, out of which you have to select the most appropriate, and these EMQs carry 60% of weightage in that particular paper. That is why most of the doctors find it difficult. However, if you practice it well, it is possible, it is doable examination. Paper 2 will also have 3 hours, 50 SBAs, 50 EMQs, and as far as time management is concerned, candidates are responsible for their own time management, but the RCOG recommends 70 minutes for SBAs and 110 minutes for EMQs. There will be lunch break between the paper 1 and paper 2. So this is also a long examination. It will take around 7 hours. So part 3 exam structure will have 14 tasks in a circuit. Each task is based on one of the 14 modules detailed in the syllabus. Each of the MRCOG Part 3 module is assessed in the context of 5 domains, that is patient safety, communication with the patients and their relatives, communications with the colleagues, information gathering, and applied clinical knowledge. So these are the 5 modules under which the candidate will be assessed. What are the fees for the RCOG exam? This is the fee structure for the 2025 examination. As it is conducted in various parts, the country are divided into 3 bands: the band A, band B, and band C. The India lands up in band B, and for band B, part 1 fees is 572 pounds. For part 2 also same 572 pounds, while part 3 it is 883 pounds. So how to prepare? Yes, you can prepare if you have the study material. The study material is given. All the guidelines are available on the RCOG website. There are books for the part 1, part 2, part 3. Books are available. If you read, and 80% syllabus is same what is there for the post graduation. Only 20% syllabus is there different, and if you prepare it well, it is a doable examination. Are there centers in India? Yes, all part 1, part 2, part 3 you can give in India. Part 1 and part 2 are computer based test. All major cities will have such kind of centers, while part 3 there are 4 main centers, that is Mumbai, Delhi, Chennai, and Kolkata. However, in one examination only 2 centers will be active. What are the issues of the overseas doctor? The passing rate for the overseas doctor is little less as compared to the UK trainees, and this is mainly because most of the doctors do not have orientation of the functioning of the NHS. However, the knowledge is very, very good, but even if they fail only borderline, because they are not aware of the system, how it functions in the NHS. Is it very difficult? If you understand the technique, it is not at all difficult. What is the syllabus? Syllabus is very vast. It is given in the RCOG website. We can download the syllabus, go through the syllabus. However, as I mentioned, the syllabus is covered 80% of your post graduation, what we do in here in India. Can I prepare on my own? Yes, you can prepare on your own. If you have your study material which is well organized, you can prepare on your own. However, the passing rate will be improved if you have a good mentor with you. What are the tips and tricks? Tips and trick will work only when you have studied the subject carefully. You can have the mnemonics to remember the difficult things. Then recalls are important for part 1, part 2. Almost 50 to 60% questions will be repeated again and again. So if you are thorough with the recalls, almost 50 to 60% paper you can pass easily. You have to prepare only remaining 40% of the things. Yes, when you are preparing, your study material should be very well organized. You can create your exam wall. You can write very important topics, flow charts, staging charts on this particular wall, so that you can revise it very fast. When the exam is near, syllabus is vast, you can cover it, this particular syllabus, in a short time. You need to be consistent and persistent in your study. Yes, mentorship do help and improves the passing rate. Group learning, when you are studying in a group, it's always better. You can learn in a better way. This is the RCOG convocation ceremony. Once you clear your part 3, you will be invited to attend this particular ceremony, and I am sure all of you will be attending such ceremony once you clear your part 3. These are the details about our course, which will be starting in January 2025. It is going to be a 5 months duration course. We'll be covering 16 live sessions, and all past recalls will be covering. These are the details, contact numbers, and the Telegram group is also there. You can join our Telegram group, and these are few links. This is the link for the Telegram group. It's a free Telegram group, and YouTube link for our previous video about how to create RCOG trainees account and how to submit the eligibility application form. I hope this information clears most of your doubts. Thank you.